This morning on The Real Story, Connecticut just introduced early voting, but what about ranked choice or how to implement no-excuse absentee ballots? We'll discuss the next phase of voter expansion in the state and some of the hurdles it's facing. Plus, as the Trump administration announces massive cuts to the Department of Health and Human Services jobs and public health funding, state lawmakers are trying to shore up Connecticut's laws. What they're proposing next. Good morning, and thanks for joining us here on The Real Story. I'm Emma Wulfhorst. This has already proven to be a busy legislative session, with lawmakers considering bills to respond to federal actions or even make moves preemptively. A big priority package is moving through the Public Health Committee, and joining me now to discuss it, State Senator Saud Anwar, the co-chair of the Public Health Committee. Thank you so much for being here, Senator.
Thank you, Emma, for having me.
So before I get into some of the specifics about this bill and some of those proposals, I do want to talk about the current federal situation. As I mentioned at the top, we know things are changing every day and every hour, but as of this taping, the Department of Health and Human Services announced massive layoffs with cuts totaling now 20,000 jobs since the start of the Trump administration. This is an additional 10,000 full-time employees laid off on top of the nearly 10,000 who have left already in the past few months. RFK Jr., the new HHS secretary, said, quote, "This is reducing bureaucratic sprawl and realigning the organization with its core mission." He says despite cutting nearly one quarter of the agency, this won't impact critical services at this time at the agency. What's been your response or your reaction to hearing the news about these layoffs?
Emma, this is a disaster. This is truly an assault on the people in the state of Connecticut, but all American people, because what we are seeing is the public health is a safety net. Public health is a plan where everything, the air that we breathe, the water that we drink, the food that we are eating, the people, what the infections that they have, everything is taken care of. That's why our lifespans have increased. That's why we are a healthier nation. We are traditionally have been a healthier nation. And as a chair of public health, when I learned about this, my heart was broken because in the state of Connecticut right now, there's going to be so many people who are going to lose their jobs, but more importantly, the services they were providing. Every child, that newborn, is going through some screening to be able to identify the illness and truly help them and change the trajectory. That program may get cut. And that's just our newborn children. And there are programs across the board in our state that are going to be affected. This is an attack on the well-being of our citizens in our state.
And some of those program cuts, we know on top of the firings, the Trump administration announced HHS is immediately terminating nearly $12 billion in public health grants for all states. Governor Lamont has come out and said this will have sweeping impacts on Connecticut, estimating the loss for the state at more than $150 million in federal funds. How do you see these cuts potentially impacting the state, especially because this is money that's already been allocated that some of these agencies already assumed they would be getting?
These are critical services. We always understand and recognize in the public health that prevention is better than cure. If we are not going to prevent illnesses, we will have to actually pay later, far more, and not only with money, but with the well-being of people. So all of these programs that we have talked about, there's going to be a big impact on them. And this is just one agency, but there's a big concern on Department of Mental Health as well, and Addiction Services. Their funding is being cut, which would mean that the physical health, physical prevention, mental health, everything is going to have an impact. And this is a critical time. After the pandemic, we have recognized the mental health challenges, the physical challenges in our society have been increasing. So this is a very painful time for people who are seeing the erosion of the institutions that have been built over so many years.
You mentioned newborn screenings. There's also childhood immunizations, testing for viruses and other pathogens, disease outbreak surveillance. You mentioned mental health. Are there any aspects or areas in which this federal funding goes to that you think people might not even realize that this will affect?
Well, the vaccines have been the most important public health, scientific, evidence-based treatment that we have been able to find. If we do not have the vaccine, and here's the reality, when we stop the public health funding, we see the impact right away, but the negative impact of that goes on for decades. So we may see generational harm from what is happening right now.
And before we talk more about the Senate bill that's moving through, President Trump is also expected to sign more executive orders in the coming days and week, including issuing more tariffs, some on pharmaceuticals. We know drug costs are a huge issue this session. They actually have been for a few sessions now. What could tariffs on prescriptions like this possibly mean?
Nothing good will come out of it. It's actually the cost of the medication is enormous, no question about it. But this is not the way to fix it. This is actually going to make it worse. And that's amazing that we actually always do the wrong thing. I hope after we do the wrong thing, we'll do the right thing. But as of right now, I've not seen it. But the cost of medication is because of entities which are pharmacy benefit managers. And they are part of the manipulation of the cost of medications. They're working with the big pharma at times, with the insurance company, so that the consumers pay the most money. And that's unethical and wrong. Rather than fixing where the problem is, we're creating a new problem. And that's not very smart.
So I want to get into this big package now, the Public Health Committee bill. Senate Democrats have called it, quote, Trump-proofing to preserve access to health care in the state. Walk me through the four main parts of this proposal.
Sure. There are a number of important parts in this bill. One of them is a very basic thing, fluoride in the water. We have the Secretary of Health and Human Services on record saying that he would want to remove all the fluoride from the water. We have decades of scientific data that shows it is safe to have it and the right amount to have it. Our bill said, and our existing law said that we will follow what the Health and Human Services say. We can't say that anymore. We are actually going to say this is the law, this is the amount that we should have, and we'll follow that. So that's one. We are also going to have an emergency communication fund for the public health, because at times what we are seeing is misinformation is very common around public health areas. So people, rather than looking at scientific data, they're going to a social media site where they're learning about public health from the person who has no business talking about public health. And that's disastrous. So we want to actually have the right communication, but also if wrongful communication comes from Washington, D.C., we have a plan of action to be able to at least take care of our citizens. We are also creating an emergency fund, and we are hoping to be able to have at least minimum of $30 million in that fund, so that we would be able to intervene and provide critical help to our citizens should there be a significant cut. Now, my feeling is, and the reality is, that's too little an amount. We need a lot more money because we do not want to have our different institutions erode within public health and the different work we are doing. So we'll probably have to have increase in that amount, but we actually have passed the bill, which is in the $30 million range. We're also creating a safe harbor. As we know that women's health and transgender communities' health is under assault in the rest of the country, we want to make sure that individuals who seek care in the state of Connecticut, we have a plan to be able to take care of their needs outside of their medical needs when they were to come to Connecticut. So we have a safe harbor account in the state, which is not going to have any public money. It will only have private money that can be used to help provide services and support to individuals who seek help.
So we know that this is a budget session, and going into this year, a lot of what I heard from lawmakers on both sides of the aisle was this was going to be a reactionary session. The budget was going to be even more difficult because they weren't sure exactly what was going to come from D.C., what funding might be cut, in what areas, and how much the state would have to kind of backfill there. As you mentioned, this bill passed out of the Public Health Committee with that $30 million mark. What does this look like in terms of budget discussions? Where is this funding coming from?
So we will have to allocate funds for this purpose. We are also worried about Medicaid funding. And if the Medicaid funding is going to be impacted, we will be in serious jeopardy for the well-being of our institution. Our children's hospitals may close down. Every child who's getting care is getting care with somehow or the other Medicaid being part of the picture. And if that slows down or stops, it's going to be a disaster, a far bigger disaster than we are looking at. So at that time, we will have to allocate funds. And I think if it comes to that point, we as a state would have to have conversation on reform of fiscal guardrails.
Yeah. I know the fiscal guardrails have been this theme of the past 3 sessions, but even more so this year. I want to ask as well about the safe harbor point. There's been a lot of conversation around having Connecticut really implement stronger protections for reproductive health care access. We've heard from Planned Parenthood of Southern New England and some of the other Reproductive Equity Now that we are seeing an increase in people traveling to Connecticut from out of state to seek either abortion care or gender affirming health care. Is that what you're seeing as well in this space?
We are, and we have heard from many of the advocates about this, and we have heard some horror stories which are happening in other parts of the country, where women are not given the right and protection, and they actually have to essentially be refugees to come here to get health care. And people are trying to protect themselves. They feel threatened, their lives threatened. And we want to make sure that we as a state are going to have empathy, kindness, respect for people, and meet them where they are and help them be part of a community and get the care that they need.
And in our last minute here, really quickly, obviously we said this passed out of the committee, but what are you seeing in terms of support? How confident are you once this goes to the full legislature? Are you seeing any sort of pushback for this bill?
Well, I'm very hopeful people will support it. And the reason I say this is a very challenging time in our history. And in these challenging times, this is a moment for us to be able to make sure that we will be there for the people of our state. Especially when the federal government is looking at the other way. They're actually abandoning our citizens. The state of Connecticut cannot allow our citizens to be abandoned. We have to take care of them in a responsible, ethical, moral manner. And I'm expecting to have serious conversations with my colleagues and move forward and pass these important bills.
Well, Senator, thank you so much for checking in with us. We'll definitely be following this throughout the session.
Thank you so much for having me.
We still have more to get to here, though, on The Real Story. We now have early voting, but what about ranked choice? Connecticut lawmakers are considering more ways to expand voter access. We'll discuss some of those proposed bills and some of the hurdles they're already facing next.